my name is Fay Itzkowitz. I'm a clinical social worker at the Barbara Davis Center for Childhood Diabetes. I've worked in the pediatric clinic for about 18 years now. So as a clinical social worker on our pediatric diabetes team, I meet with children and families newly diagnosed with type 1 diabetes every single day, Monday through Friday. So we see kids who are newly diagnosed and then kids who are living with type 1 diabetes day in, day out for much of their lives. And my job is to meet with those families and offer emotional support as well as financial resources and outpatient therapy resources to help them cope with the many issues that come up throughout life with type 1 diabetes. I think screening is super important because finding out that you're at risk for diabetes allows you to know what the signs and symptoms are, so that kids don't end up as ill as many of the children that we end up seeing in clinics sometimes do. You can avoid some of the more kind of acute issues that come up and arise out of diabetic ketoacidosis. This way, families are more tuned and looking for things like peeing a lot and drinking a lot, and are more aware that those could be signs of type 1 diabetes, and I think ultimately may protect their pancreas's ability to produce insulin for longer. So I think in my work with children and families with type 1 diabetes, what I found is the most common misconception that families are faced with is that they feel like they could have or should have done something differently to have avoided this diagnosis. And I think what I've come to learn over a lot of years is that despite a lot of research, we still don't know exactly what causes type 1 diabetes. And I think that's why continued screening is so important, is hopefully in a sense will continue to contribute towards our knowledge of what leads to this, so that we have something that we can actually tell families when they get this news.